You are listening to the AI World Podcast, your trusted source for the latest innovations, insights, and trends in artificial intelligence, blockchain, fintech, and decentralized technologies. Each episode features expert interviews, engaging discussions, and in-depth analysis of how AI transforms industries worldwide. Stay ahead of the curve with the latest articles and exclusive reports from the AI World Journal, covering everything from emerging technologies to industry breakthroughs. For more news, global events, and access to AI World Society circle gatherings, visit us at aiworld.tv. Don't forget to subscribe to stay informed, stay connected, and be part of the AI revolution with AI World Lounge. Thank you for listening.
You step into your next doctor's appointment, and you feel, well, truly informed, like empowered, an active partner in your own health. What if you had a tool, maybe something on your phone or computer, that helped you really grasp your entire medical history, your meds, the treatment options, all before you even saw the doctor? Well, that's exactly what we're diving into today. This fascinating and, kind of complex emerging world of medical AI advisors. Our mission here is to cut through some of the noise, give you a clear picture, drawing on some great insights from the AI World Journal.
Exactly. And, the goal isn't about AI replacing doctors, not at all. It's exploring how artificial intelligence is starting to reshape things by working with clinicians, like a co-pilot, really, enhancing what they do, hopefully elevating patient care. It's about making that human expertise, well, even more effective.
That's a really good way to think about it, a co-pilot. Okay, so let's start with this really compelling personal story from the journal article. It's about the author who had prostate cancer a few years back, thankfully cancer-free now, who decided to try something pretty bold for their checkup in early 2024. They basically gathered up everything, old diagnoses, lab reports, treatment history.
All of it.
Yeah, and fed it into an advanced GPT model, ChatGPT specifically.
And the result was, well, honestly, pretty eye-opening. The AI didn't just spit out data. It gave this incredibly clear, structured explanation of their whole medical journey. Laid out all the drugs, why they were prescribed, the treatment paths still on the table.
Wow.
Yeah. So this meant the author walked into the doctor's office actually prepared, ready to ask smarter questions, really understand the meds, and, actively participate in the decisions. It shifted their role, really, from just receiving care to being engaged in it.
That sounds incredibly empowering.
It is. But, and this is the really crucial bit the author stresses, they make it crystal clear. AI did not replace my doctor. That's a direct quote. They emphasize that the doctor's expertise, the guidance, the emotional reassurance, the empathy, that human connection, irreplaceable. The best care, the best treatment still comes from human doctors. The AI was a powerful tool, absolutely, but just a tool.
That personal angle really drives home the potential impact. But okay, let's get into the nuts and bolts. For people listening, medical AI advisor, it still sounds a bit, abstract. What exactly are we talking about here technically?
Good question. Yeah, let's break it down. So at its heart, a medical AI advisor is a pretty sophisticated AI system. It combines a few key technologies. You've got machine learning, which is how it learns from tons and tons of data. Then there's natural language processing, or NLP. That's how the AI understands, human language, like reading complex doctor's notes or research papers. And finally, clinical reasoning. That's the AI's ability to sort of apply medical logic to a specific patient situation. A bit like how a doctor thinks through a case. Think of it like a super smart assistant for the medical team.
Okay, an assistant. So what can this assistant actually do?
Right, the functions, they're pretty diverse. First off, they're amazing at analyzing really complex data. We're talking electronic health records, imaging reports, lab results, even genetic profiles.
All that stuff.
All of it. Second, they provide evidence-based insights, so they can quickly summarize the latest medical research or treatment guidelines, but tailored specifically to your unique situation.
Personalized.
Very. Third, they can generate hypotheses, suggest possible diagnoses, predict risks for certain diseases, recommend potential treatment options for the doctor to consider. And lastly, a big one is enhancing decision support, acting as a sort of second set of eyes for doctors, especially in complex or urgent situations. That's incredibly valuable.
Okay, that does sound powerful. But, my mind immediately goes to data privacy. If I'm
Yeah.
feeding all my incredibly sensitive health information into an AI, how do I know it's safe? Where does it actually go? That seems like a huge trust barrier.
Oh, absolutely huge.
Hmm.
And the source article really digs into this. The absolute baseline for any legitimate medical AI platform is strict compliance. So in the US, that's HIPAA. In Europe, it's GDPR.
Right.
That's non-negotiable.
Right.
And that means things like robust encryption are essential.
Mm.
Data needs to be protected when it's sent, when it's stored,
Yeah.
locked down completely. And critically important, your explicit consent is needed before anything gets shared or analyzed. They can't just take your data.
Okay, so encryption, consent, what about the where does it go part? Is it staying on my phone or...
That's a great point. It varies. Some tools are designed to do all the processing right there on your device, so the data technically never leaves. That's obviously very private. Others use secure cloud servers. In that case, the encryption during transmission and while it's stored on the server is absolutely critical. Generally, the safest systems are designed to hold on to the data for the absolute minimum time needed, maybe even deleting it right after processing.
Got it.
And another layer is anonymization, stripping out things like your name, your address, anything that directly identifies you before the AI even looks at the health data itself.
That makes sense.
And it's not just privacy. We also have to talk about bias. This is crucial. If the AI is only trained on data from one specific group of people, its recommendations might not work well, or it could even be unsafe for others.
Right, it could perpetuate existing inequalities.
Exactly. So these systems must be trained on diverse, representative data sets. And they need regular checkups, bias audits, to make sure they're fair and safe for everyone.
The author actually gives some really solid advice here, basically saying ask these questions yourself. Before you share any sensitive medical history with any AI, find out about its privacy and security.
Absolutely. Be an informed user.
Yeah, so things are moving fast. The article mentions ChatGPT-5 unveiled just recently, August 7th, 2025. How does something like that push the boundaries even further?
Yeah, ChatGPT-5. It represents a pretty significant leap, especially for healthcare applications. One key thing is just deeper comprehension. It's much better at understanding the nuances and medical language, complex patient notes, research papers with greater accuracy than older models.
Okay.
This leads to what they call conversational precision. So it can answer really complex clinical questions, but in language that's clear, backed by evidence, and actually understandable for both doctors and potentially patients.
And it's not just text, right? I think you mentioned multimodal.
Yes.
Yeah.
That's a huge one. Multimodal analysis. It means the AI isn't just reading text. It can look at medical images, lab charts, genetic data, and text reports all at the same time.
Oh.
Yeah. And it can find connections between these different types of data. Imagine it spotting something subtle in a scan, correlating it with a specific lab value in the patient's history, then cross-referencing recent research. That's the kind of synthesis that could take a human team ages. The AI can potentially flag things much earlier.
That sounds almost futuristic.
It's getting there. It's also incredibly fast at summarizing research. Doctors struggle to keep up with the fire hose of new medical papers. An AI like this can process thousands daily and pull out what's most relevant for a specific patient.
A massive time saver.
Huge. And maybe most importantly for trust. Explainable AI, or XAI. This means the AI can actually show its work. It can explain the reasoning behind its recommendations. Why does it think this diagnosis is likely? What evidence supports this treatment suggestion?
Right, you need to know why.
Exactly. Without that transparency, doctors aren't going to trust it, patients won't trust it. Explainability is key for real-world adoption.
Okay, so these advisors are clearly getting very sophisticated. Where are we seeing them actually being used now? Or where's the big promise in the near future?
We're seeing traction in several areas. Clinical diagnosis and triage is one, speeding up accurate diagnosis, especially in busy places like emergency rooms. An AI could potentially analyze symptoms and history quickly, maybe flagging critical conditions faster.
Makes sense in the ER.
Definitely. And medical imaging, like we touched on with multimodal analysis. Radiology, pathology. AI is getting really good at spotting subtle, early signs of disease on scans that the human eye might miss.
Catching things earlier.
That's the dream, right?
Right.
Personalized treatment planning is another big one, tailoring therapies based on someone's unique genetic makeup, lifestyle, other health conditions. Also, drug discovery. AI is dramatically accelerating the process of finding promising new drug candidates by analyzing molecular data incredibly fast. And predictive analytics, identifying patients who might be at high risk for, say, hospital readmission or developing a complication, so interventions can happen proactively. Plus, there's the administrative side, automating paperwork, scheduling, freeing up clinicians to spend more face-to-face time with patients.
Less bureaucracy, more care.
That's the hope. And it's not just theoretical. The article mentions that Medicare is actually planning to start using AI next year to help inform some coverage decisions. So you see these administrative and predictive aspects starting to scale up.
Okay, so there's clearly enormous potential here, technology advancing like crazy, but let's circle back to the human element. With all this powerful AI, what does it mean for the role of the doctor, the nurse, the actual human healthcare professional? Because that connection feels so vital.
It absolutely is. And it's critical we don't lose sight of that. The article rightly points out that, healing is more than data. And AI can analyze symptoms, suggest treatments, but it can't replicate the reassurance a patient feels when their doctor looks them in the eye and says, okay, we have a plan, we've got this.
Right.
Or just that compassionate human touch during a scary or difficult time. That empathy, that connection,
Right.
AI can't do that.
So the core message isn't replacement.
Not at all.
Yeah.
Emphatically not. AI is an assistant, a tool, a co-pilot, like we said earlier. The future isn't AI or humans. It's AI and humans. It's this partnership. Skilled, empathetic medical professionals bringing their judgment and experience, augmented by the speed and analytical power of AI. That's where the real magic happens.
That brings us right back to the author's own experience, doesn't it? The AI was this incredible tool for empowerment. It helped them feel informed, confident, but their actual recovery, their peace of mind, that came from human expertise and compassion. It's both.
Precisely. And look, as AI like ChatGPT-5 gets even better, the potential benefits for diagnosis, treatment, access to care, they're huge. They'll keep growing. But we have to stay focused on the safeguards, protecting patient privacy religiously, actively fighting bias in these algorithms through really careful design and ongoing checks, and always ensuring the technology supports and enhances the human side of medicine, never replaces it.
So it really sounds like the future hinges on getting that blend right. The power of machine intelligence combined with, well, the human heart.
That sums it up perfectly. Human heart plus machine intelligence. And maybe a final thought for everyone listening. As these AI tools become more common, think about how your own relationship with your doctor might evolve. How can you maybe use these advancements to become more informed, more engaged in your own health, while always making sure that essential human connection, that compassionate care, stays right at the center of it all.
The future of artificial intelligence is unfolding, and it's happening at AI World Week, the flagship global event for innovation, collaboration, and transformation. This flagship global AI event is designed to connect visionary leaders, trailblazing entrepreneurs, and influential thinkers to explore the endless possibilities of AI. Experience groundbreaking technology that redefines industries and inspires progress. Join thought-provoking discussions on ethical AI, digital equity, and the transformative role of technology in our world. Build meaningful connections that catalyze innovation and drive impact. AI World Week is powered by AI World Society, a global movement dedicated to advancing AI responsibly and ensuring it serves humanity. Together, we're shaping a smarter, more inclusive, and equitable future. Continue your journey beyond the event with the AI World Journal, offering expert insights, in-depth analysis, and the latest trends shaping the AI landscape. This is your opportunity to lead, to innovate, and to transform the world with AI. AI World Week. We invite you to join us and embrace the AI revolution.